Hi, it's Dr. Kathy here, and today I want to talk to you about something that's really important. I'm not a paid actress, never done any training, but I'm making content because I care. And I would really appreciate if you'd actually watch and listen to this because this is about medication safety. And I want people to be safe using medication. The reason I'm making this is because we've had some issues. And there's some information that people don't seem to know. And so I want to give you this information to help things to be smoother and having less side effects of medication, less problems. When I prescribe most medication, I give people a written handout, information that I've put together. I'm not aware of anyone else who does this. And this information is about how to start medication, potential for side effects, when to stop it. And I would really appreciate it if you actually read that information. Now, if you can't read very well, there's actually an app that can go on phones or on a tablet that through the camera will pick up the text and read to you the information that's written. Or you can take it to your pharmacist with the script and they'll go through it with you again. And it's really important to do this. It appears to me most people think that the pharmacist is just to label the medication and give them the right one, but they're there for much more than that. They're there to talk through with you to make sure you know how to use the medication and also to talk to you about any side effects or potential for side effects. They have access to databases that I don't have access to. And so if there's something that's not on the handout I've given you, then if you talk to them, they'll be able to look up whether or not this is one of those incredibly rare things or something I just haven't seen. They're very helpful and they're there for you. We are, however, having some troubles with e-scripts, and there's two issues. One of them is that pharmacists are holding on to the repeats. So when I send you a link on your phone, if you hit that link, you'll be able to access one lot of dispensing of the medication. Only people are trying to hit that link a second or a third time to try and get the repeats access through that same link. But it doesn't work that way. Your pharmacist needs to either hold on to the scripts with your consent or send you back the repeats. But it appears to me they're holding on to the repeats and they're not actually talking to you about it. Because I'm getting so many people saying, oh, I don't have the repeats. And the issue is the pharmacist has held on to them. So please talk to your pharmacist about this. And then the other trouble we're having with scripts is I'll write the script, I'll send the SMS, but it doesn't actually arrive on the phone. Now, we've put signs up in the office, but even though I tell people, they're still not checking to make sure they've arrived on their phone. Please check. And the reason I'm saying this is that some of the scripts that I write, I can't resend. There's a lot of rules. And in order to get it to you, if you didn't receive it, I need to print paper or it needs to be printed to PDF and emailed to you, all of which takes time and effort. And I've asked people, we've got signs up and they're still not checking before they leave. So don't be offended if we charge a fee for the services to download the script and actually then generate it into a passcode protected email if you don't want to come back and get it. Then other issues we're having is about people wanting a script without an appointment. Now, the medical board has come down really strong and essentially no appointment, no script. There are some slight exceptions. So occasionally we'll have a conversation, we'll try some things, and then I'll update the script with a second script. Now, because it's all linked back to that appointment, then I can do this and I can justify it to the medical board. But don't just randomly contact us and say, hey, we've run out, we want more, because it doesn't work like that. The other big problem I've had is with people starting medication when their child is sick. And I know that if a child has a bacterial infection, we start antibiotics and they get better. But when it comes to medication for sleep or mood or behavior, please don't start it when they're sick. Please wait till they're well. And please don't push the dose up too quickly. Now, part of the trouble that people are having is the script will call for you starting with a quarter, but you're not able to cut it into a quarter. And that's where you need something called a tablet splitter. Now, this is where there's a blade here, and you pop the tablet into the slot and it will just simply cut it. And with most medication, the tablet splitter will work well. The other thing that's useful is to have a dosette. So a dosette is something where you've got morning and evening and sometimes even 3 dosing times a day, 7 days of the week. And you can then start to help your child learn to be independent with medication. Children need your supervision up until the age of 15. That's the evidence. And so using a dosette, you're able to take that step back, and yet they're still getting some peripheral supervision. And the other thing which I really want people to understand is about medication metabolism. So with medication, there's a variety of different genes that metabolize medication. And so there's different metabolism. And so when we start medication, we would usually start with too little. Now, the red line is above this is too much, below the blue line is not enough, and the green is how it's released in the blood. So this is a graph of a child taking medication, but it doesn't even cross above the blue line before it comes back down. So it's not in the zone, so it's not doing anything. But if you jump too high too quickly, then you're going to go up to too much. And that's what happens when people jump too quickly. There are some people that are what are called slow metabolizers. So they'll take the medication, and as well as it'll go too high on a tiny dose, it'll last way too long. I've had a 10-year-old, 45-kilo young man who a quarter of a Ritalin lasted 16 hours. Now, if you don't know, a quarter of a Ritalin is the dose for a 16-kilo, not a 45-kilo child, and it should last 4 hours. And then we've got just right, and that's what we want. But if you don't use a pill cutter and you don't go through the dosing slowly, then you're going to jump from too little to too much. And then the other thing to show you is that with regards to metabolism, there are now some tests on cheek swab and blood. I don't do the blood ones on metabolism. So I'm a fan of this one, which is My DNA Life. And so they have a couple of different kits. They have the multiple category medication test. Now, this will test for 100 different genes for not only the mental health medication, pain, gut, heart, and other medication. The more simple one is the mental health medication test only. And the price here isn't the final price. If it's added to the cart, you'll then see that, I've got 2 because I did this before. You'll see that for 2, it's a total of $104.60. And then there's the postage. So what happens with this ends up being around about $208, and this ends up being about $157. And it'll give us the various genes for many, but not all, medication used in these areas, and tell us how things are metabolized. So I've had one particular boy where we tried a couple of medication and he reacted. And so then we did this test, and what it showed was that there was nothing in the green that he could take, that was safe for him. There were medication that are for children that are older for him, but not for those that are younger for him. There were a few in the orange and most are in the red. And so there's a lot of medication that he can never have. And so we tried something in the orange at low dose and he's done well. For him, the too low dose actually ended up in the just right dosing range because he's a slow metabolizer. Then along comes his brother who's 2 years younger and we tested him and lots of things in the green. So we had a lot of choices, which is awesome. So this test isn't something that you can initiate easily. It is something that you need to go through your doctor. So if I'm seeing your child already, then I'm happy to do a form. Feel free to email me and we can send you the form to follow this through, and I'll get a copy of the test and your GP will get a copy of the test. And then once I've received it, you get an email that says it's now available and we will give you a copy. The reason why they don't send it directly to the families is because there are some people who will read this and not understand, and they'll just get overwhelmed. They'll get flustered and distressed and worry. Whereas I'm able to interpret it and work with you to understand it. If your GP hasn't used this test, there is a number somewhere on the website, and it's also on the bottom of the results, where doctors can ring for an interpretation. And I've rung and spoken to the pharmacist. They're very helpful. So if I'm not yet seeing your child, but you've got an appointment coming, then you could go back to your child's GP, the one who wrote the referral, and organise for the test so that when I do see your child, the results are available. That would be something helpful. And so I'm hoping that this has been a helpful video. If there's any feedback, other questions, if I need to remake this, please let me know, and please be safe with medication. Have a great day.